Hi, everyone, and welcome to the show, Desire Wellness with nurse practitioner Deidre Arms. She has been talking the past few weeks about nutrient deficiencies, mainly caused by medications that are popular in cardiovascular and vascular disease treatments. This week, we're focusing on iron deficiencies, which above and beyond the medications, I see so many patients who have vascular and cardiovascular disease that have iron deficiencies, and we're going to talk about why and what we can do about them. Just remember, the advice and view offered should not be considered a replacement of that of your own healthcare team. Make sure you do check with your own healthcare team to get explicit consent before acting on any information provided here. Do not act on any information provided here without your doctor's explicit consent. Got it? Okay. We'll move on. Hi, nurse practitioner Deidre Arms here with us. Thank you so much. A couple minutes late going in, but we're here and we're good.
Yes, we're here. It's a beautiful Wednesday. It's storming here in Ohio. So,
Nice and sunny here in California. Um, it's great for that vitamin D. We've talked about those vitamin D deficiencies that can be caused by the medication. So if people want to go and find out more about that, they can go on to www.youtube.com/the weight of my heart and look for Deidre's personal desire wellness playlist, and you will find more about vitamin D deficiencies there and so many other things that we've already talked about. Do you like that segue? Do you like that little plug? Oh,
I
wait, don't
do.
forget to like and subscribe. Now, I think everyone's going to want to. So, oh my goodness, this is going to be a great topic. Iron deficiencies. So, where should we start there? Talk about the role of iron in the body, and then the different deficiencies that you might have with it and what
Yeah.
causes them. So,
Mhm.
iron. What what role does iron play in the body?
So it's a mineral that's essential for the body. Its primary role is to transport oxygen into the blood, part of the hemoglobin, and that's a protein in the red blood cell. So iron's also involved in energy production and it supports your immune function. So you see how important it is in the body. It's part of the red blood cell, your energy production, your immune function, something that we all have to stay on top of. So.
Something that caught my attention is the fact that it's critical to carry oxygen, right, in the body. And so I would imagine that if you have a wound that is not healing, that's definitely something that you should have your doctor also check on, is whether you are getting enough iron.
Exactly. You want to know how much, what your iron levels are. If you have a wound or something, you really want to know what that energy production and that oxygenation to the cells. So
Are there different types of iron deficiencies that you might have?
there are, um, let's see here. Sorry about that. I have this outline.
And I was just bobbing around in the different
So
different things.
you can have
We can go in order.
no, you can have a decrease in iron levels without it being, and you can have anemia from iron deficiency as well. So
What are some of so I guess what causes that deficiency in iron, and what are those risk factors?
if we're not getting enough of the intake of our iron-rich foods, especially those common, like people who have a vegetarian or vegan diet, that can be part of it. Your increased iron needs, and this would be like children and women who are pregnant or menstruating definitely have a higher need for iron. However, with chronic blood loss or gastrointestinal bleeding or poor absorption of iron, if they have GI disorders from different surgeries as well. And some of the risk factors include, poor diet or celiac disease, inflammatory bowel disease. So not just having GI symptoms, but actual inflammatory bowel disease. And then people who do frequent blood donations. So if they're having to do that because of their disease process as well. And then there can be medications that interfere with iron absorption.
So what are the symptoms of iron deficiency?
So fatigue, that's a big one because of,
There's so many with fatigue. Oh my goodness. If you go into your doctor and say, I'm fatigued all the time, they're like, we
yeah.
could go here, we could go here, we could go here.
Well, and you think about it like as we've been through all these nutrients and these vitamins, we're really like there's a lot of overlapping, so it gets kind of fuzzy, like what could it be, right? But definitely fatigue, pale skin, so a decrease in that hemoglobin level can make you look pale, especially in the face or the inner eyelids and your nails. Some people get short of breath. I want to give a little personal story. So after my open heart, I would get short of breath, just walking into the next room. And I just kept saying, this is so crazy that it really does this to you. And we later found out that I had iron deficiency anemia that was causing it. And it wasn't just my disease state or what was happening with me post-op. So
What a relief, because it's something that you can do something about in a
I
very,
was
like
so
half an
happy.
hour.
I was like, I could have treated this a month ago had I known, but I
Right.
didn't,
The last thing you want to hear is, okay, short of breath, you need to go in for a heart cath because your right coronary is blocked. Like that's the last thing that you want to hear right after having your open heart.
Exactly. And then you can feel dizzy or lightheaded. Often people will say that they're feeling really dizzy or they're lightheaded, and that reduced oxygen delivery to the brain is what causes that dizziness or lightheadedness. People feel like they're faint. I've had a lot of patients say that they have headaches, and it's their iron. So they have, because of the anemia, it can cause headaches, particularly like a dull one that worsens with activity. So you're thinking it's delivering oxygen to the cell. If it's not doing that, you're getting a headache. And when do you have the higher need for oxygen? When you're active. So some people get cold hands and feet, so that poor circulation because of the reduced oxygen carrying that can lead to that. The nails can become brittle as well. Restless leg syndrome. So when you're trying to sleep, that can be one of the ones with deficiency. And then pica, I don't know if you guys have heard of that, and that's that craving for nutritive substances like ice, dirt, clay, chalk. Like that's a real thing. I had a friend of mine who just craved like crazy ice and was ready to like fight someone if she couldn't get her ice every day, and it was iron deficiency anemia.
Okay, but dirt? I mean,
Yeah, yeah. It's called pica.
seriously.
Yeah.
But I mean, how would you know that you craved dirt if you've never eaten dirt?
So people actually eat it when, and you can see that in kids also. So if you would see a small child like eating dirt a lot every time they got outside and they were putting it to their mouth, that's often a time like we'll test for iron because of that. Yeah.
Is that just something that's intuition, just something that, they just, you're iron deficient and you just automatically, I mean, I wouldn't reach down, I don't think, and go grab
No, it's
dirt.
true. We wouldn't think about that, and they really can't explain why it happens, but it's a known phenomenon that happens. It's like because ice does not replace your iron levels by any means, neither does dirt, but the body craves certain things like that. Even clay or chalk or starch can be one that they're craving as well, and they call that pica. So.
Interesting. So is all iron deficiency considered anemia and vice versa?
No,
Because
it's
I've heard,
not.
oh, really? Okay.
Yeah, so the anemia part has to do with also um, your hemoglobin and hematocrit. So part of like getting a CBC drawn and looking at the um, hemoglobin and hematocrit. So if those are not low, then it's not anemia, it's just iron deficiency by itself. So anemia is really refers to not enough healthy red blood cells to carry adequate oxygenation to the body. And then iron deficiency is the most common cause of anemia, but anemia can
Excellent.
be different factors as well. So.
Okay. I just have heard it so many times. Oh, you're anemic. You need to boost your iron.
Yeah, so you can be low in iron and the hemoglobin hematocrit not be low. Most of the time they do occur together, but yeah,
They don't have to.
they don't have to.
Okay. And so you were saying not all anemia is caused by iron deficiency.
No, some of the anemias that we see, some can be genetic, like sickle cell anemia or thalassemia. You can also have a B vitamin deficiency, that's a type of anemia as
Hmm.
well. So there's different blood tests for each of those that you would want to know. But the most common is just a deficiency in iron that we see.
Okay, so how do you test for iron deficiency? So is it just blood, or do you have to do any sort of biopsies or anything like that, or is it just clearly blood?
It's the blood test.
That's
It's
it.
probably one of the most common, simple things to do. There's several things when I draw to look for, iron deficiency. I don't just draw an iron level. You want to know the measure of your hemoglobin and hematocrit. You want to look at ferritin, which is your iron stores, and then your total iron binding count is another. It's TIBC. So when you're looking at your labs, you might notice all these things that's being done in relationship to iron, and that's how we figure out like what need do you have? Should we just add foods? Should we supplement with something? Should we consider even further like injection or something of that sort?
It's
But
interesting because my mom's level for ferritin was sky high. Didn't and they said that that was iron, and I thought, well, can't you do something about it? Shouldn't we do something about it? Isn't it a sign of something? And no one did anything about it, and I just thought that was interesting. I mean, I don't know if anything could be done about that. And I would imagine if you have high ferritin levels, then they would probably determine whether or not you need to do something depending on the actual iron levels. But
exactly, you're looking at the whole picture of everything. Sometimes high ferritin levels can be because of non-alcoholic fatty liver disease as well. And so you have to look at the whole picture. And some people who have those chronic inflammatory conditions, such as rheumatoid arthritis or lupus or chronic infections, TB to name one, they can stimulate increased ferritin as well because it's produced by the liver. So,
what level of deficiency do you usually see symptoms of, with this iron deficiency?
so that's a good question, Kim, because you don't always see it in somebody who has mild anemia. It can vary, but it's often really noticeable when the iron stores start to significantly deplete, and that causes that hemoglobin level to drop. And so when the hemoglobin level starts to drop, that's when people start to be more symptomatic with what they're doing, or like having more fatigued or shortness of breath, things of that sort.
Okay. So who should be tested for it? I mean, I guess if you have no symptoms, do they test anyway? Is this just something that's part of the annual exam?
It's actually not part of the annual exam that happens. We really look at higher risk individuals. Many of those are people with a diet that are vegan, vegetarian, women who are menstruating, especially females, but people with chronic medical conditions should be. That should be part of their annual. So people with peripheral arterial and cardiovascular disease should have this done annually as well. They should be screened. Um, but routinely on a well person, it's not.
So it's kind of like chicken and egg thing here. But why is it that so many cardiovascular and peripheral artery disease patients have anemia and or the iron deficiency? Is the anemia caused by the cardiovascular or peripheral artery disease, or is the anemia a factor in the cardiovascular or peripheral artery disease?
So anemia in cardiovascular patients we know is really multifactorial, right? It can be caused by that chronic inflammation that's associated with cardiovascular disease or kidney disease because that affects your erythropoietin production or your blood cell production there. And those medications like blood thinners can lead to bleeding and that can lead to subsequent iron loss as well. Somebody on a blood thinner who has like a colon polyp that originally might not bleed very much could have a lot more bleeding in the colon related to the blood thinner and become anemic and not really start to notice it unless they're actually seeing blood in their stool. So those are the things like when you're on these anticoagulants, you don't just bleed when you cut your skin or you're shaving or something, but if you have a polyp in the colon or for female cervical polyps, those can cause a small amount of bleeding too, but over time that can end up to a lot of blood loss for somebody who's on an anticoagulant.
So even with benign polyps, it could actually lead to dark stools.
Yes. So it doesn't always
Wow.
indicate cancer when it's dark stool, but if a polyp is bleeding within, yeah, that would be why. And people who take blood thinners are a little, increased risk is known for bleeding.
Okay, so what treatment, and this is what everyone's waiting for, what treatment is there for iron deficiency? I know you mentioned some earlier, there are injections and things like that you can do, but would you mind running through some of the treatment options for it?
So initially, it just depends. If it's low, we want to first figure out where the bleeding's coming from. Is it coming from bleeding? Like where is the deficiency in iron coming from? Because we want to stop that. That's the downstream thing. If you're having blood loss, we stop that so the iron can come up. We want to include iron-rich foods. And then there's different iron supplementations that we can use. Iron specifically, if you're taking it orally, needs to be taken on an empty stomach with vitamin C. So I usually say that's one we take in the morning before our breakfast or anything because it's better absorbed if it's not taken with food. And then there are several different like iron infusions and injections that can be given for somebody who's severe or who has this chronic iron loss or is hospitalized because of it.
I want to go back to the iron deficiency, the getting the iron before your meal in partnership with vitamin C. Now, do most of the iron supplements have vitamin C integrated, or is this something that you need to somehow figure out the balance and talk to your own healthcare provider to say, hey, how much vitamin C should I be taking with this?
Right, so there are several that have a combo. There's even some prescription ones that have the combo with the vitamin C, but not all have the vitamin C. And so in that case, I tell people even take it with eating a little bit of an orange or something citrusy. I try to stay away from telling you to drink it with orange juice because of how glycemic or how high the glycemic index is with orange juice and it can shoot a blood sugar up, but a little bit of citrusy fruit even can help break that down if it doesn't have it with it. The cheaper forms of iron may not have vitamin C with it. So,
That's good to know because I know when my doctor talked to me about adding iron, they never said to take it with a vitamin C or with citrus or anything. And it really irritated my stomach and also TMI, that it caused increased upset other things.
mhm.
And I felt like I couldn't leave the restroom. And so I don't know if the vitamin C helps with all of that.
There are some like better absorbable ones for the GI tract
I
that
was
would
using
help.
a cheap one. You can just say it. I was using a cheap one. I know where this is going. Okay. There are just some things you can't,
But so sometimes we
go to the
get what we
dollar
pay
store
for.
for. Okay.
Yeah.
I'm hearing you.
Yeah, most people have a lot of constipation related to iron intake, and
Really?
especially some of the over the counters that you take. And so that's why a lot of people don't want to take it. Like you tell a you know, person who's already having some GI issues, take this, bring your iron up, and then they can't go to the bathroom.
Oh,
Well, that's not desirable at all.
no. So, what do you usually tell your patients when they have that issue and they
So
have to take this iron?
yeah, I like to have them take one that's better on the stomach, and I also
Yeah.
like to tell them to increase their fiber intake. But there are a couple brands that are prescription that actually have collace in them or a stool softener
Oh,
added to it, so it takes care of that piece too. And some people do have to have stool softener with
the
iron.
iron.
And that's
Yeah.
something to definitely talk about with your provider. I wouldn't just go buy a stool softener because it's causing constipation. I like talk to somebody before you go do a stool softener with that. But fiber intake, so your leafy vegetables and getting lots of intake of that is helpful.
So I was just looking at Dr. Google and it says they don't, doctors do not treat for low or mild deficiency, just severe. Why is that?
Well, the mild
And how
iron
do you define
deficiency,
treatment, I guess, is probably a better question.
I would say Dr. Google might be talking about treatment as an injection
Oh,
or IV, like iron infusion or something like that. And we don't always treat for that. Like there's a specific patient that we would look at, like, because we know that if we stop the bleeding, your iron is going, like, you're going to remake the red blood cell. And so you're going to be able to improve your iron with foods that you eat rich in iron as well. So dietary changes alone can really correct a mild deficiency. So we don't have to be supplementing. But it should be based on the circumstance, right? And get your doctor's advice for this. Like, don't just go out and take iron, but getting it through your food source is probably the best.
such a great segue to what I wanted to ask you next. So, what can patients do independently to help improve iron levels? What are those iron-rich foods? How about using, and actually got an iron skillet just for this purpose.
Okay. Yeah, I have one too for for this purpose as well. But cooking with an iron skillet can increase the iron content, particularly if there's an acidic food like tomatoes being cooked in that and everything.
Oh, so it's food dependent.
Um, yeah, you're going to get more absorption of the acidic foods from the iron in the skillet, but to improve your iron levels, meats. So you see why vegan and vegetarians have such a hard time because most of it's your lean meats, your poultry, fish, but then beans and lentils, tofu, spinach, and fortified cereals also have some added iron to the how they fortify the cereal.
So when should you decide on using a supplement? I mean, of course, you always want to get your opinion, the opinion from your own healthcare team before any supplementation. But how do you know when you should start an iron supplement?
So it's really based on the blood test and what your symptoms, your blood test. They can recommend dietary changes alone, and then if that's not sufficient, then look at, are there absorption issues with iron? What's going on? A lot of times they'll try to find like a corrective phase, like what can we correct
Okay.
to improve the iron?
So if we do have the permission from our healthcare team to use that iron supplement, and I would imagine they would tell us the dosage, right? Do you have any criteria for choosing one if they're saying, hey, you know what, we're not going to prescribe it, go ahead and get one off the shelf?
Okay, so there's a couple different types of iron off the shelf, that ferrous or ferric, and you're looking at like absorption rate, your side effects of it, and then injections are reserved for like people who don't respond to those oral supplements, or they're not affected, or they can't tolerate it. Like injections are for when we want to bypass the stomach for someone as well. And so some of the ones with ferrous sulfate, you hear about that. That's a good one to add a little bit easier on the stomach as well.
Do they actually say on there that there's vitamin C? And I'm imagining that it would be on the
It
list.
should. Yeah.
Okay.
Like whenever you get a supplement, it should list what's on it. Um, you know, I often use like really high brands of things that I know like don't have fillers or anything in it. And one that I really like is called Ferrocell. I like it that way. It's because it's ferrous bisglycinate chelate, and it's called Ferrocell. That's a type of iron that it is, but it really just means that it's more bioavailable. So it's really, the body can absorb it and utilize the iron more efficiently. It's gentle on the stomach. That's the biggest complaint when you take iron. And there's less interference with other foods and medications when you take like Ferrocell. And that's typically used to treat, like if your numbers are low on that, and they tell you to pick up a dosage of something. And it's usually, some of them do have some vitamin C, so you have to pay attention to that, or then you can take vitamin C or eat with citrus or something to enhance that iron absorption.
Can you spell the one that you were doing it, and we can put it in the chat for folks?
Yeah,
How do you?
Ferrocel.
Perfect.
Yeah.
Fantastic. What if you were talking a lot about the, making sure that when you do take one, there are certain ways in which you can tell that it's gonna be better for those with the sensitive tummies,
Mhm.
such as myself. Um, do you ever find that there are people that just can't take any sort of supplementation or injection or anything like that?
With the iron, so I don't personally do the injections. I send people to have either the injection or the IV, and there's known that people don't tolerate all of those. So there's many different of those injections now. So if you didn't tolerate one, it doesn't mean you wouldn't tolerate another form of the injection or IV form. Some of them are a one injection type thing. Others go over like a course of 6 injections or IVs that will happen. So there's lots of options now that we didn't used to have. So if you didn't tolerate one, there's other options now, even with the injections, if we have to bypass like the GI.
Gotcha. Yeah, it's just a matter of tolerating the try and try again and then try
Mhm.
again. That would
Yeah.
not. I've had some of our patients that have not tolerated it at all, and then they don't want to go back to try again because the side effects were so horrible for them individually.
Yeah.
So it's just one of those things, though, that iron is incredibly important, and you got to find a way to get it in there. And it might not be fun to go through the process, that journey of finding the right option for you, but I would imagine, nurse practitioner Deidre, you would agree that it's important that you do find that option and find a care professional that will work with you, to make sure that you can find one that's right for you.
Yeah, it really is important to find one that's right for you and that you can tolerate and everything. And then thinking like, why is your iron low? So is it the chronic disease or is something going on? And like helping to find that downstream of what's causing the low iron and correcting that can be really beneficial too, because just giving iron and not figuring out why you have the low iron, well, that's not helpful to anybody, right?
No, because there's always a reason. There's
Yeah.
some reason why, and if they don't know, well, then you need to get a second opinion and give it another try and explore because yeah, my next question is, how long do people usually have to take these supplements and how often should they get tested if you are low and you're on these supplements or you're on these injections because the whole thought process is that it sounds as though this is not a lifetime commitment for most. There is a reason there's some sort of bleed, there's some sort of other deficiency that's leading to this.
Right. And so the duration depends on the severity of that deficiency and how the person responds to what we're doing here. And so it can be a few months or even longer, but often until the iron levels kind of restore and they become maintained for a while.
Fantastic. Well, we have quite a few questions coming in that I was so on my course of like, oh, what questions do I have? I did not see the stream of questions coming in the chat. So
Okay.
I'm guessing that we should start um with Kim. Kim, do you want to jump in and ask your question? Go ahead and unmute.
Yeah, I'm just wondering if you have a high RBC count, would that be lack of iron or too much iron?
High RBC,
So that's the red blood cells. So RBC
Right.
is just I'm just for the audience, the red blood cells. So an elevated red blood cell count, can that be due to a lack of iron? That's what you're asking,
Or too much iron?
or too much iron? Oh, that's
um,
interesting.
so with the RBCs, usually I don't really see a lot of changes. We see lower RBC when we have an anemia as well. So if I see a high RBC, just kind of wondering, is that polycythemia vera? Like what's going on with the white blood cells and the platelets as well is what I'd want. So while iron doesn't influence the red blood cell production, it can lead I guess, to an increase when the body compensates for low oxygen. So that's polycythemia vera, but it's not caused by an iron deficiency or its correction. Does that make sense?
Yes, thank you.
And Kim, you had a couple other questions?
The other one I was just wondering about, if your thyroid is low, is that also a lack of iron as well? Or could be?
Can be. This is such a good question with thyroid, low thyroid, and iron because the thyroid needs specific nutrients to function properly. So oftentimes, if iron is low, thyroid will become more hypo for people. And so there is a correlation with your iron and it being low and causing hypothyroid.
And then Kim, you were also I liked your other question that you were also going to ask.
I was going to ask, can you have too much iron? And if so, what problems does it cause?
You can have too much iron, and well, I guess the body usually doesn't make too much iron, but you can have too much iron or iron low, and that's a hereditary condition called hemochromatosis. So that's typically a genetic problem where the body absorbs and accumulates too much of that. You can get that though, that hemochromatosis, it's such a long word, when somebody is getting blood transfusions as well, or if there's chronic liver disease, or if they're taking too much iron supplementation as well. And so the treatment for that hematomacrosis is actually blood draws removing like blood. So you just do phlebotomy and they remove the blood. So this helps to reduce the iron levels as well. Some providers do chelation therapy, but not all. And that's medications to really help remove the excess iron if that's happening, if they're not able to do that with using a blood draw or phlebotomy as well. And then some
Thank
of
you.
the complications of having too much high iron can be cirrhosis of the liver and even arrhythmias in the heart, and joint damage as well.
Thank you, Kim, for all those questions. Those were fantastic. We
They really
appreciate you.
were.
And we have Alan that has a question that I think he wants to unmute and go ahead and ask Nurse
Hi.
Practitioner Deidre. Hi,
Hi.
Alan.
Hi. I was first diagnosed with anemia last September, and it sounds a little strange, but I know that it was caused by 2 blood pressure pills that I was put on. That those pills reduced my body's ability to absorb iron. So I took an iron supplement pill, and I changed my diet to a heavy red meat diet and eating as much spinach as I could, broccoli. I changed my diet to an iron enriched diet, and that enabled me, and I took an iron supplement pill, and that enabled me to recover. In February, I got diagnosed with PAD, and I changed my diet again. I went to an almost no red meat diet, and I lost my focus on putting iron into my body. So a couple of weeks ago, my anemia came back on me, and I've changed my diet. So I'm putting iron enriched foods into my body. I'm back on the iron supplement pill. My question is, given that I have both anemia and PAD, should I eat red meat?
That is a question definitely for your doctor specifically, but let's just kind of talk about that, the relationship between anemia and PAD. So with anemia and PAD, you're really wanting to improve. I'm sorry.
No, that's okay. I wanted to, just address that red meat first. And I'll go ahead and I'll jump in here on this, because I know that it's very controversial, and I know that there are different philosophies that you could follow, and that's why at the Global PAD Association we don't choose the diet. We know that there's a different diet that every person is going to choose that is going to be right for you, and it's a decision that you make in partnership with your care team and your philosophy. I can tell you from personal experience with my own dad, when he was diagnosed with heart disease, he was 78 years old, and the hospital near us was a big proponent of the Dean Ornish heart disease reversal diet. Dean Ornish lives right here in my county. I've interviewed him a couple times before. He's very passionate, has a lot of conviction in the data that he has for following his diet, which is whole foods, plant-based, and that's it. For my dad, he had what was called an MTHFR mutation, which actually ultimately his dietitian, who now has a doctorate in diet, I don't know what that's actually called, but needless to say, neither here nor there, has her doctorate. She came and she said, whoa, wait a minute, your blood work is completely off. What's going on here? You're on this, special Dean Ornish diet, and you are getting worse. And we realized that he was having a reaction because he had this gene mutation, which made it troublesome for his body to turn food into fuel. So he couldn't have anything with like enriched flours. Now, that was one aspect. The other aspect, he ended up severely anemic. And I know he's sitting in the other room, testosterone levels dropped. And with all of this happening, the dietitian was like, this is not the right diet for you. you need red meat. You need a lot of red meat, not
Really?
just some, you need a lot of it. And so she worked with us. There was a catch. Doing the red meat was not something that was for a low budget diet. She said, I want no hormones, no antibiotics, all grass fed. And here's the kicker, grass finish. And I don't know about you and how hard that is to find, but she said that is the only meat I want you to have. And then no more. She wanted him to have a 4 ounce, piece a couple times a week.
Okay.
But that was between my dad, his doctor dietitian, and that was their decision. And that helped bring his energy levels up, his B levels raised, his iron went up, and he no longer had what was called high homocysteine levels, which is an enzyme that it's not broken down if you're not turning food into fuel, right? And so we eliminated a lot of all that stuff, upped his protein, up the red meat again, and reduced all of the other stuff. And he's done a lot better. So it's got to be an individual decision for you. There's data that supports different aspects of it. I see red meat's good for you, red meat's bad for you. But is it just the standard red meat that you buy that's bad for you? Is it the quantity that people are eating? I don't know. All I can tell you that is in my dad's case, that's the diet that was right for him. That was what was decided between him and his care team. And I also had seen, if you go on YouTube, there is another peripheral artery disease patient who has gone on a carnivore diet. And he was told by his team that that was the best thing for him. And so he posts all the time on YouTube how eating that way for him, he's lost all the weight that he's needed, and he's seen an improvement in his blood flow because of it. So it's something that's got to be an individual decision. And with that, I'll move it back to I took the pressure off of nurse practitioner Deidre on that one, because I think that's what you were saying, Deidre, was it has to be up to you and your care team, depending on which diet you choose, right?
It really does. And that's the whole thing. It gets a little tricky, and why would a carnivore diet be good for somebody? It also could be because of blood sugar. Like sometimes we'll, use a higher protein diet, carnivore like, to help decrease blood sugar for people to get weight loss and everything. So it's like whatever we do, we have to look at the whole patient as well. But I really like that you honed in on like the type of meat that you're eating to be like really pure meat. And that's what we need to be looking at, like that it is grass fed and grass finished, and like the most pure organic that you can get of meats is the healthiest for us, that doesn't have the hormones and it hasn't been processed, and meat glue hasn't been put into it, and all the things that can happen to our meat sources.
And coloring too. I knew that there was some coloring being put into some salmon, but I had no idea that it was being put into red meat as well. And I found that out, and I was horrified. So now that's something I double check on as well when I'm choosing that for my dad.
Yeah. And we've found some good farmers. There's, find a local farmer that's doing that. There's quite a move to make awareness. Yep. Move to get the good food in.
Yes. Yes.
And so you were going to address, before I cut you off, you were going to address the connection between PAD, peripheral artery disease, and anemia.
Yeah, and so, with peripheral arterial disease, there's also this not getting enough oxygen to the lower extremity as well. And so I wanted to just be mindful that how important iron is for the diet, and having that checked, because when we have this low hemoglobin hematocrit, I'm sure you felt really tired. I think you were saying before, and that's that number one symptom that people start to have with it.
And Alan, in making those changes, I think the key is, how do you feel since making those changes? Do you feel any better?
I feel a lot better today than I was 2 weeks ago. So I know it's making a difference. And I feel better today than I felt yesterday. It's a really slow process. Last time I had it, it took me almost 3 months to get back to feeling somewhat normal. And I'm not expecting to feel great for, I don't know, at least a month and a half from now. But I am doing better every day is what it feels like. So,
Oh,
the
that's
changes I've made of refocusing on an iron enriched diet and taking that supplement, it does make a big difference.
that's interesting. And did they found out why? And I'm sorry, I missed the beginning of your story there because I was looking at all the questions, but did they find out exactly why you are deficient all the time?
I told my doctor that I am absolutely convinced that it was 2 blood pressure pills
That was the 2 blood pressure
that
pills. Okay.
they put me on, because I was on the blood pressure pills for a month, and that was about 2 months before I got sick. And I researched those pills, and both of those medications I found in rare occasions may cause anemia. And so I know that that's what did it to me. It changed my body's ability to absorb iron.
Yeah, it can be the medications for sure. And then chronic inflammation can also play into that and why it took so long. So,
Well, I'm sorry, I wasn't aware of that, because I have chronic inflammation. I've had it for 7 years
okay,
in my back and my shoulder, my right shoulder. And,
okay.
and I didn't realize that in itself might have caused my anemia.
Yeah, it can affect your iron metabolism and reduce kind of your red blood cell production. And PAD is an inflammatory process too.
Yeah,
So there could be a little bit of that impeding it. And then those medications might have just been what tipped you over the edge
yeah,
with that as well.
yeah, yeah.
Right. Any other questions that you have for nurse practitioner Deidre? I see that Marcia actually has a comment which I find interesting, Marcia, that after your diagnosis, you started a vegetarian diet, and you were walking an insane amount, but during that time, your body started craving meat. And now I eat it every day, she says, including fish and chicken. And Marcia, you can nod. Are you feeling better in doing that?
Oh yeah. Oh yeah. I mean, my body was telling me, sometimes I think when I ate like crap, I felt like crap. And I think your body tells you what you need, if you just listen. So
Yeah,
I did have a question though.
Oh, go ahead.
Oh, I was just going to ask, when I was a young girl, I was iron deficient, but I had heavy menstrual periods to the point where I fainted and, I would pass out. Do you think, like, I don't know that I've been tested since then. Do you think that there would be any reason to, or do you think that was cause and effect?
So most of the time in young women with heavy menstrual bleeding, that is the cause of it. However, as we age, inflammation does increase depending on our gut microbiome, depending on our disease processes. So if you have any diagnoses in the cardiovascular diabetes realm, I would say get it tested, yes. So.
Thank
Definitely.
you.
Thank you, Marcia. Any other questions before we wrap up with Deidre? Deidre, we did have another question that came in that wasn't about iron, so I wanted to finish up the iron deficiency before we finish up with the question that came in based on one of the other conversations that you and I have had over the past few weeks.
Okay.
And any other questions about iron before I move into that? Any other thoughts on that?
I have a question.
Okay, go ahead.
I'm taking an iron supplement. It's 150 milligram elemental iron pill that it's not a prescription pill, but you can't buy it off the shelf. So the pharmacist, he keeps these things. Should I be taking this pill for the rest of my life? I'm not certain what to do. If my iron level goes back up, when my iron level goes back up, should I stop taking this pill or should I just?
So you definitely want to talk to your doctor about this, but oftentimes when we get you stabilized and you've been stabilized, taking you off of it and then repeating a lab to make sure that you on your own can keep that iron level up based on the foods that you're eating. So you really are going to want to closely talk to them and have the labs drawn to know, because we don't want to get you back to a place where you're so depleted like you were and feeling that way.
So if I'm got to that point where with my doctor's consulting with my doctor where I said, okay, I'll stop taking this pill. How long should I wait before I get retested?
Probably 4 weeks, because a life cycle of a red blood cell is 21 days. So
Okay.
4 weeks to see if you produce your own with iron and everything.
Okay, that's helpful. Thank you.
Welcome.
Go ahead, Douglas.
Well, she can send me. I will talk later. But my question, my doctor just called and I have a scheduled blood test, and I told him I wanted everything checked. But I do remember one show you talked about, well, you have to ask for this because it's not included in like a regular blood test.
Okay. It could have been homocysteine. It could have been your B12 and your folate and insulin. Those are several that are not included all the time.
So is there a list I can find of questions to ask to make sure?
I'm so glad that you asked that, Douglas. You can go to padhelp.org and we have a list of blood tests that you can request. You can also download the book or go to Amazon and get our Food for Thought book, and there's a whole list of wonderful blood tests that you can request from your doctor. That was a shameless plug, but we can also I can work with after we get through with quite a few of these, we can Deidre, maybe you and I can get together and we can consolidate all of these just for basic nutrient deficiencies into one sheet that we can put up on the website and co-brand between Desire Wellness and Global PAD Association that patients can bring into their doctors.
Yeah, that'd be great.
The other question that came in was, I think it is, it's in regards to anemia, but it's the first part. Kelly says, please ask the nurse practitioner if the absence of B12 only causes pernicious anemia, or is it any anemia? That's her first question.
So
but isn't pernicious anemia, isn't that more of a bone marrow issue?
Yes, and so you can have a B12 deficiency and it not be anemia at all. So that's where we have to check part of the complete blood count for that.
Yeah.
And then pernicious anemia is a type of B12 that is autoimmune condition. So it's an autoimmune response, and there's some genetic factors that play into that as well.
And she wants to know if chronic venous insufficiency or bruising that never go away can actually cause or be caused by anemia. So if you have, so it sounds like she has chronic venous insufficiency. That's not caused by iron deficiency, but bruising in the areas like in the calf or in the lower leg, or could that be a sign of anemia? Is bruising a sign of anemia? I'm just trying to, it's
Yeah,
not
actually,
written clearly.
if I have somebody, so that's kind of a double question. So when you have inflammation, it can decrease that absorption and how we utilize iron. So an inflammatory condition can cause that. And then bruising, to me, when I see people who are like bruising and they bruise really easy, like they bump their arm and they've got a big bruise, or the dog taps their leg, I will do an iron level, because oftentimes I find that they're deficient in iron, folate. So if you're having that, I would request to have your iron looked at.
Sounds good. That was a good question, Kelly.
Yeah.
So what do you think for next week? We have quite a few folks here that may want to weigh in and get some. I'm thinking that we get a lot of questions about the difference between, general diabetes and insulin resistance.
Ooh,
And so I'm thinking insulin resistance might be a really good topic. And I think we could get an entire hour on that one.
I
Yes.
promise you we can.
It sounds like, and you can thank Marcia on here for that one, she sent me a TEDx video this morning of a doctor on there presenting about the fact that that the obesity issue in the US is not just the way it seems, that so many people are insulin resistant and don't realize it, and until they know what's causing it, that it is insulin resistance, they can't seem to make any sort of changes in
Right.
their life that make a difference. So it'll be interesting then.
That would be a great one. So send us some questions early so I can be prepared.
Fantastic. Yeah, go ahead and send them in. For right now, you can go ahead and just send your questions to kym@thewaytomyheart.org. Oh, wait a minute. My producer Joshua is going to scold me here. kym@padhelp.org. New email just announcing today. So go ahead, kym@padhelp.org, and I will prepare those, and I will make sure I send them to Nurse Practitioner Deidre before next week's show. Again, the topic for next week's show is insulin resistance. And so that's going to be an amazing topic. So if you want to find out more about insulin resistance, tune in next week. If you want to find out more about Deidre and her practice over there in Ohio, go to desirewellness.com. Is that right? Desire Wellness Group. Desirewellnessgroup.com. But thank you everyone for joining us. We really appreciate it, and have a good week.
You too. Take care, everyone.